By way of introduction, Nadia is actually a health legislative assistant in the office of Senator Cory Booker. So she previously was selected for the 2021 David A. Winston Health Policy Fellowship, where she completed her placement with the Senate Finance Committee under Chairman Rob Wyden. During her graduate studies, Nadia worked as a project coordinator at the Feinberg School of Medicine down in Chicago, which is a near and dear to my heart, Center for Child Trauma Assessment Services and intervention supporting projects that focused on training frontline providers in trauma-informed care, building and enhancing trauma-informed and strengths-based practices for transition age youth and the intersection of race and trauma. She additionally interned at the Association of Maternal and Child Health Programs as a CARES intern, focusing on telehealth policy changes being implemented by states and jurisdictions during the COVID-19 pandemic that impacted the maternal and child health population. Prior to entering graduate school, Nadia worked for the Association of Maternal and Child Health Programs on the Women's and Infant Health team. During Nadia's time at AMCHP, she supported projects focused on maternal and infant mortality and breastfeeding. In the very little bit of spare time that she has, she was also the founder and CEO of Coco Queens, a social enterprise whose goal was to use hair extensions and products as an unconventional avenue of exposure for breast health information to create breast health awareness and access to health information for African-American women. Nadia, you are absolutely impressive, and we are so thrilled to have you. You really seem to fit in with our group perfectly, so please take it away. We are very happy to have you. Thank you.
Thank you. Yeah, it's always awkward to hear your resume read, but I appreciate it. I appreciate the kind words. And hello, everyone. Like Allison said, my name is Nadia Lenian, and I'm the lead health staffer for Senator Cory Booker of New Jersey. So happy to be with you all this evening. And I just want to thank you for letting me join your call. And I'm excited to talk about health policy, health equity, the end of the COVID-19 pandemic public health emergency and what that means for providers, dynamics of the 118th Congress, and of course, women and children and everything health. I know that is something that you all are interested in. So I love being around people who are interested in maternal and child health. So I wanted to firstly recognize that today is the first day of Black History Month and open this conversation with a quotation from someone who's often quoted. And I think that's because of his profound thoughts and words really remain true today. And that is Dr. Martin Luther King Jr. And the quotation is, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane." And I think that this sentiment really fuels the work that we do on the health team in Senator Booker's office, because access to quality and affordable healthcare for everyone is a cornerstone of Senator Booker's priorities when it comes to health. So I think that Allison pretty much told you all what my background, so I won't introduce myself any further, but I will jump straight into some of Senator Booker's priorities when it comes to the healthcare space. And so healthcare is a very important issue for my boss. And I think just generally when it comes to the landscape of policy, healthcare, you see that coming up in so many different areas because it is so essential to our being. But Senator Booker really believes healthcare is a human right and that everyone should be able to access quality and affordable healthcare. And because of that health equity, and which is the belief that everyone has a fair and just opportunity to attain the highest level of health, health equity is really the foundation of the priorities on our health team. Some additional priority areas, though, for my boss are increasing access to healthcare generally, drug pricing reform, reproductive health, increasing access to addiction treatment, and addressing things like the opioid epidemic, and ensuring accountability and transparency within the healthcare system. So there were a few bills that Allison sent over to me that I will discuss with you all today, most of them in the maternal and child health space. I think those will be of most interest to this group. So firstly, I'll start with the Black Maternal Health Momnibus. And so these are statistics and things that you all will know, but I'll just say for the benefit of the entire group. But unfortunately, out of all of the developed nations in the world, the maternal mortality rate in the US is the highest, and it is continuing to rise. In a recent report from the Government Accountability Office, this report shows that the number of maternal deaths in the US in 2021 was nearly 80% higher than the number in 2018, which, when you think about it, is a really striking number. And as you know, the COVID-19 pandemic really made a lot of things that were already bad in our society worse. And it contributed to the worsening of this issue as well. So in the same report, it stated that COVID-19 contributed to 25% of maternal deaths in 2020 and 2021. So this situation is unfortunately even more dire for Black and Brown individuals in the United States. And Black birthing people have a 3 to 4 times higher mortality rate than their white counterparts. Native Americans are more than twice as likely to die from maternal mortality, and Hispanic birthing people are almost twice as likely to die than their white birthing people. And unfortunately, this continues to get worse. From 2019 to 2021, the maternal death rate increased 56% for Black women and 118% for Hispanic women. So Senator Booker leads the Black Maternal Health Momnibus in the Senate, which he inherited from now VP Kamala Harris, and Rep. Alma Adams and Representative Lauren Underwood lead this bill in the House. So the Momnibus is a historic series of 12 bills that comprehensively address the drivers of the maternal health crisis and makes critical investments into addressing things like social determinants of health, funding community-based organizations, growing and diversifying the perinatal workforce, and improving data collection processes. And so this bill has been introduced twice. It was originally introduced in the 116th Congress in 2019. We will be introducing it again in late summer or early fall of this year, and we'll probably be adding to the 12 bills that we've introduced in the past. And since it was introduced in 2019, only one bill in the Momnibus has passed and been signed into law, and that is the Protecting Moms Who Serve Act, which was led by Senator Duckworth in the Senate and Rep. Underwood in the House. And that bill, it commissions a comprehensive study on the scope of the maternal health crisis among veterans specifically, and even more specifically looks at racial and ethnic disparities of maternal health outcomes in that group. So in the maternal health space, we also have the Maximizing Outcomes for Moms Through Medicaid Improvement and Enhancement of Services, or the Mommies Act. I actually think that's probably one of the first times I've said the full name. We always just call it Mommies because it's kind of a mouthful. But Senator Booker introduced the Mommies Act in May 2021, and his partner in the House on this is Representative Ayanna Pressley. And the bill would help combat our nation's maternal mortality crisis by enhancing coverage for pregnant people covered by Medicaid. So the bill would extend Medicaid coverage for new moms from 2 months to a full year after childbirth, because we know that I think it's a third of maternal deaths happen in the postpartum period. It will also facilitate Medicaid coverage for doula support, and then increase access to primary care providers and women's health providers. So there has been progress around this topic in Congress in the last couple of years. So in the American Rescue Plan Act, which we often refer to as ARPA, and this was one of the COVID-19 stimulus package bills, Senator Booker really urged for postpartum Medicaid coverage to be included because, you know, in general, women need this care, but especially during a global pandemic. So we were successful because ARPA included an option for state Medicaid departments to extend their postpartum coverage up to a year postpartum. And this bill, this provision passed, and ultimately 20 states and the District of Columbia adopted this state option. But we didn't want to just stop there, because my boss felt really strongly that this shouldn't just be an option for states to elect into, that every state should have this coverage. And also this provision in the American Rescue Plan Act was set to end, I believe it was like March 2027. So at the end of this past Congress that ended just in December, Senator Booker again urged for permanent Medicaid coverage in every state nationwide to be included in the end of year omnibus spending package. So unfortunately, we didn't get permanent postpartum coverage in every state, but they did make the state option permanent. So now every state has the option to expand Medicaid in their state, and we hope that every state will uptake this. But Senator Booker is still committed to making this permanent coverage nationwide and not just a state option. And so another bill that we have in the maternal and child health space is the Health Equity and Access Under the Law for Immigrant Women and Families Act, and we call it HEAL. As you can see on the Hill, we like a lot of acronyms. So HEAL has three main pillars. First, it expands access to Medicaid and CHIP to anyone that is federally authorized to be in the United States, including DACA recipients, and it removes the 5-year waiting period that currently exists for lawful permanent residents to access Medicaid and CHIP. Secondly, it enables undocumented immigrants to purchase health insurance plans from the Affordable Care Act marketplaces, and also benefit from healthcare subsidies. So like the tax credits you might have heard of in the news. And currently, undocumented immigrants are banned from buying insurance in the Affordable Care Act marketplace, even if they would purchase at full cost. And then third, it restores Medicaid eligibility to migrants from the Federated States of Micronesia and the Republic of the Marshall Islands and the Republic of Palau, whose Medicaid eligibility was stripped in 1996, I believe. So as you can imagine, insurance rates are lower among non-citizens, included both documented and undocumented immigrants, and barriers to health coverage, unfortunately, disproportionately harm immigrant women, who are the majority of immigrants and particularly likely to have low incomes and be young and uninsured, and also be caring for children. So this bill would expand access to that group. So I've talked about an omnibus, the end of the year spending bill that passes Congress every year. And I just wanted to talk to you a little bit about some of the other health provisions in this huge package of bills that pertain to your interest areas. So my boss was very supportive of mental health provisions in the omnibus for children, and also other Medicaid provisions just generally. So with mental health, Medicaid and CHIP, there were provisions around Medicaid and CHIP requirements for health screenings, referrals, and case management for eligible juveniles in public institutions. So prior to this, when someone would enter the juvenile justice system, and even for adults in the justice system, they would lose access to their Medicaid or CHIP benefits. And a new provision in the end of the year omnibus would allow children in the justice system or youth to be able to access health screenings and referrals and case management. And also, it would require that justice-involved youth who are eligible for Medicaid and CHIP would receive screening, diagnostics, and case management services 30 days prior to their release. And then there was also some removal of limitations on the federal financial participation for inmates who are eligible juveniles pending disposition of charges. And then in Medicaid and CHIP, we were able to extend funding for CHIP for 2 years through fiscal year 2029. CHIP has to be reauthorized every few years. And so with the omnibus, we were able to extend CHIP until 2029, and then we'll have to reauthorize it again. And then also required children to be provided with 12 months of continuous coverage in Medicaid and CHIP effective January 2024. So another thing that I wanted to talk about is Medicaid unwinding, which you may have heard about, and is an issue that will be happening now, especially with the end of the public health emergency for COVID-19 up and coming. So for some context, in the Families First Coronavirus Response Act, which became law in March of 2020, they suspended eligibility determinants for the Medicaid program and allowed for continuous enrollment because we were going through, it was unprecedented times in the beginning of the COVID-19 pandemic, a time that I don't like thinking about. We wanted to ensure that individuals wouldn't be kicked off of their health insurance at the time and wouldn't lose their Medicaid coverage. So this led to significant enrollment in the Medicaid program, and states were unable to remove anyone from Medicaid, even if they only needs to be on Medicaid temporarily, and they started making an income above the Medicaid levels, they still had to remain on Medicaid. I believe there's about 90 million people on Medicaid currently, and it's typically like 70 million. So there was a fear that the public health emergency end date, whenever it was announced, and now it has been announced, that there wouldn't be enough time for state Medicaid departments to prepare to go through what we call the redetermination process, which is deciding, basically state Medicaids go through everyone who's enrolled in their plans, and they kick off people who shouldn't be on it anymore and keep people that should. And sometimes that process is a bit messy, and people who should remain on Medicaid get kicked off. So it's a process that should be done delicately, and it takes a lot of time. And the administration promised to provide 60 days notice for when the public health emergency was to end, which wouldn't be enough time for state Medicaid programs to have to deal with this. So the omnibus, so in this omnibus, they decided to uncouple the Medicaid redetermination process from being attached to the end of the public health emergency. So basically, giving it a different timeline that has nothing to do with whenever the public health emergency was set to end. So now states can begin redeterminations as of April 1, 2023. And the law provides a phase down funding over 9 months with significant guardrails put in place to support the process, and things to ensure that people who are getting kicked off of Medicaid have sufficient notice. I think generally the requirement was to send a letter out to someone once. Now if you send a letter and you don't get a response, you'll have to reach out in a different way. Different things to ensure that this process happens as smoothly as possible. So yeah, I have a little bit left to go through. Before I close, I wanted to also touch on the dynamics of a new Congress, because we're now in the 118th Congress. And as you probably know, we are in a split Congress now. Republicans have the majority in the House and Democrats in the Senate. And when there is a split Congress, legislative work does tend to slow down a bit. It isn't as fast paced when a party has the House, the Senate, and the administration. So you probably won't see as many big sweeping bills like the Inflation Reduction Act happening in the next 2 years during this Congress. But bipartisanship is always important regardless, but especially critical in a split Congress. And my boss has always looked to reaching across the aisle and partnering with his Republican colleagues. And that is really the strategy on our health team. We're hoping to engage with folks that we've engaged with before, and hopefully engaging with new colleagues across the aisle, and try to align on mutual priorities so that we can continue to make progress for the American people, because there's so much we can do to improve our healthcare system. But another thing I wanted to note during a split Congress is that there will probably be more oversight. So in Congress, you can send letters to the administration to urge them to act and use their executive functions. And so that's something that I know we will probably be doing more of. And I think in general across Congress, you will see a bit more of that as well. An example of this is in October 2022, we led a letter with Representative Castro and Jayapal in the House, urging the Department of Health and Human Services to grant access to benefits under the ACA and CHIP for DACA recipients. So this is a portion of what is in our HEAL for Immigrants Act. And this is something that the administration can act on as well. So we are using our legislative powers to try and get something passed through the House, but also calling on the executive branch to also use the functions that they have as well. So yeah, I think I had 30 minutes, I believe, and I guess I did 25, but I know I just threw a lot at all of you. So I will end it here and just pause for any questions or any clarifications. Hopefully I wasn't too jargony in my speech, but thank you all so much for listening.
Great. Thank you so much, Nadia. That was a lot, but I think it was really helpful to get a sense of kind of what Senator Booker's doing, but also sort of what else is going on nationwide. We'll open this up either in the chat or if people want to unmute and ask questions, because I have the privilege of also being sort of a facilitator. I'm going to actually ask the first question. And for me, that would be, what in this split Congress, what bills or what individual things do you see as potentially getting through? Like, where do you see bipartisanship actually being successful?
That's a great question. And I think there are some priorities that we share on both sides of the aisle. I know addressing the opioid crisis is a big priority, especially the House. Both committees in the House with jurisdiction over health, which is Ways and Means, and the Energy and Commerce Committee, they have come out and stated that the opioid crisis is going to be a big area of focus for them. And I know particularly for my boss, that is definitely one. I think also mental health. So last Congress, the Finance Committee, which has jurisdiction over things like Medicare and Medicaid, the Affordable Care Act marketplaces, among other things. I was actually working on the Finance Committee last year, and we had embarked on a mental health initiative, bipartisan mental health initiative, to address things like youth mental health, workforce, crisis care. And although many of those mental health pieces were included in the omnibus package, I think there's still room for a lot more, including like mental health parity, so that is another issue. I know the Finance Committee has talked about wanting to do chronic care. So I think that's something that can get bipartisan support. What else am I missing? Oh, and I think drug pricing is always something that we want to work on. Whether that can be bipartisan, not sure, but that is another priority. I think that's a priority that you might see from the Democrats, but yeah, and I think another area is potentially is with children's health and like mental health and children's health as well, that intersection. So yeah, those are a few things. Hopefully we'll see more. Oh, Allison, I think you might be muted.
Thank you. Yeah, I think, well, oftentimes we think of like drug pricing to be Medicare related, kids use lots of medications too, and there's lots of opportunities there as well. And I think mental health is certainly on a lot of people's radar. Nancy Kavanaugh, you have put in, another person put in about advocating for LGBTQ and abortion access. And Nancy, I don't know if you want to expound on that a little bit in terms of a question, or Nadia, if you want to just kind of talk about how we might, as nurse practitioners, be able to advocate for our patients as well.
Yeah, I mean, I think those are two very important issue areas. Unfortunately, with abortion access, that is something that is not bipartisan. My boss has a few bills in the abortion space, and particularly focused on medicated abortion. I think as nurse practitioners, something that you all can do as like your group, but also as individuals, is talk to the representatives and senators in your districts. Now that I'm on the Hill, I was pleasantly surprised to see how much constituents, issues actually matter, because you think like, oh, these people are off in Washington, they're, like doing what they want. But when constituents call our offices, like that is something we note every single call. And if somebody is bringing up a topic over and over and over again, that's going to rise to the top. And a Congress member is going to pay attention to that. And especially if you're in a state that abortion access is getting prohibited, and other issues related to the LGBTQ population are, being impacted. If your congressperson hears from you, that is always really important. But I also think framing all of these issues as healthcare issues first, and not just a bipartisan issue, that helps as well, especially hearing from providers. Hearing you all frame it as that, I think that helps to guide to guide politicians and what they will do, even if just marginally. It definitely still helps. So hopefully that's helpful.
I think I can speak on behalf of a lot of the people on this call, and that just, it makes my heart warm to know that it actually matters. As someone who has sent many an email and made several calls, that it feels good to know that it actually has an impact. So thank you.